11:04 again, just like Greg, man. The last show of the decade, last show of the year, the PinPoint Health Show.
I did not even think of that.
Right?
Yeah.
Pretty scary. You're getting old, son.
That's crazy.
I know.
It's been, what, 3? Not as long as Greg, but I think 3 years now?
Yeah, back to the Dr.
4.
Payne days. Now
back to
PinPoint
Dr.
Health.
Payne days, yeah. Pretty incredible.
Yearly
It's
wrap-up.
amazing how time flies.
Yeah.
It's insane. Very, very insane.
416-870-6400, star 640 on cell. You have questions about your well-being, your health, bring them on. That is the mainstay of the show here over the course of the next hour. What's been happening in the past? Well, I know what's been happening in the past week. It's been Christmas, but generally, what's going on with PinPoint?
Yeah, lots of stuff. We're working on some big things for 2020 in terms of expansions into different cities. Can't really say right now, just based on non-disclosure agreements that I've signed and things like that, but always continuing to grow the brand, get a clinic closer to you wherever you might be, which I think is the goal. When you look at the research around if someone lives at point A, how much would they want to drive in terms of wanting to go somewhere to get healthcare? And the research shows that it's about a 15-minute drive radius. So most people will say, like, yeah, if it's 15 minutes away from me, I'm likely to go.
Right.
And then as you start to move away from that distance, then obviously it becomes harder and harder for people. So that's really, within the GTA, an eventual goal is to sort of be within 15 minutes of most people in the greater Toronto area, maybe the greater, what's the bigger one, the GTA, sorry?
Yeah. Southern Ontario, maybe the
Golden Horseshoe. But that's sort of the goal, is to really have a place to build PinPoint to a point where it's somewhere that's close to you, 15 minutes away from you, so that you can get the care that you need. The accountability, the customer service aspect is huge for us. I'll actually share a story that we had happen this week at our Brampton West location. A gentleman had sent his daughter for a massage with one of our massage therapists, and she had massage, and everything about the massage was great, but I guess something towards the end of the experience, in terms of the way the massage therapist was speaking to her or giving her advice on something, that this girl she just wasn't digesting the information, and she actually thought that the massage therapist was being dismissive, and so she told her father, who had brought his whole family over to our clinic at PinPoint Health in Brampton, and he spoke to our office manager there, and she said, like, I'll get you to call Dr. Lewin. You can talk to him personally. Sure. And right off the bat, he was already, like, even surprised that I would, and that's sort of a policy. Anytime someone has a problem, I just tell my office managers, give the person my cell number and tell them to call me at their convenience. Happy to talk to them. And he called me, and he shared the experience that his daughter had, and he just, he said, everything has been great in terms of the customer service with the reception and office manager, even the massages. Him and his son have been having massage therapy with another massage therapist, and everything has been good. Mm-hmm. And he says to me, there's this one little thing that just is now sort of tainting the experience for us. And my daughter does not want to go see that therapist again. And I said, well, that's fine. I think everyone is entitled to a second chance, even this therapist, because might have been a bad day, might have been a bad moment, whatever. But I said, definitely we can make sure that we talk to. And he basically said, like, listen, she's not going to see that person anymore, but we're okay to see someone else. So I said, no problem. I recommended somebody else. I said, see this person, get the advice that you need. Right. We had a nice 10-minute conversation. He was very, very thankful that I would, A, take his call, B, listen to him. And I essentially told him, my job is to listen. I want to hear the things, the experience that our patients have, because that's the only way that we can improve. And so a couple things happened there. Number one, we spoke to the massage therapist. Then again, like we always talk about, there's always more than one side to a story, right? There's one experience, the other experience, and probably whatever you want to call the quote unquote truth of that experience. And so I think a lot of these things come down to a misunderstanding of some sort. But even regardless, we made sure that this girl was treated with another therapist. She got the care that she needed. Her father then even called me after the experience and said, thank you so much.
Wow,
everything was great. Thank you. So that's the level of customer service that we want to be providing at PinPoint Health. And again, this is something that I am personally overseeing. This isn't like I have somebody else taking care of those items. These are big ticket items for me because I want to make sure that when people are coming into one of our clinics, seeing any one of our professionals, that we can have that dialogue. And the other thing is I thank this patient and this gentleman that brought his family over because it's so refreshing to speak to someone who can understand. Like, this was not a person who was combative, called me yelling or anything like that. No, he wanted to have a dialogue. And I think that's the right way. And we were both able to figure out a solution that worked for him and for PinPoint Health. And I thought that was great. So I thanked him for being that type of person because we all know now, with Google reviews, something small happens, it's taken out of context, and then there's this massive negative Google review of some sort, and people just never want to have dialogue. And I think it's so important that if an organization is willing to have the dialogue with you, well, why wouldn't you want to do that? And so that's what PinPoint Health is all about. We're willing to have that dialogue, to understand the extent of your experience and do whatever we can to rectify it. Because, for me personally, I've dealt with a lot of different companies, a lot of different things in my life. And I've always said I don't mind when companies make mistakes. It's always about how you handle that mistake, because then anybody could do that, right? Mm-hmm. Like, mistakes are just a natural thing that could happen. Now, if it's the same mistake over and over again, that's a problem. But if you can do your best to rectify a mistake, I think that speaks volumes about an organization.
Good way to start, my friend. We'll take a short break. Again, you got tons of time now till 12 o'clock to bring on your concerns about your health over the past year or looking forward. Get out, talk about it, ask. Dr. Payne, Dr. Lou's here to answer your calls. 416-870-6400, star 640 on cell. PinPoint Health Show continues. Global News Radio. It is 11:15. Yeah, you have some health concerns, some stuff you want to talk about. Bring it on. It's 416-870-6400, star 640 on cell. info@pinpointhealth.ca or simply PinPoint Health on social, Instagram, and Facebook as well.
Yeah, and you know what? On that point, last week, I sort of had a shout out to everybody to sort of add me on right. Instagram, and it actually works. So let's do it again. There's a ton of amazing content that our social media company that we're working with is putting out on there under the guidance of me and my team in terms of what the content should be, but they make it look a certain way, they make it feel a certain way, which is the stuff that I would not be good at. And it's just very good free content. I don't know why you wouldn't look at it and the links and all the things. So Dr. Lou on social in terms of Instagram or Facebook, or PinPoint Health on Instagram and Facebook, or even on LinkedIn. I'm not sure. I don't think there's Twitter. Do they even use Twitter anymore? I don't know. Now,
I never got
what's
Twitter.
The new thing now? TikTok?
No, TikTok is completely different.
That's
for
different?
adolescents watching videos.
Oh, is that what it is? We don't have that, but I know,
really?
Jody, are you in with all this stuff?
My niece uses TikTok.
Oh, yeah?
She's all over it. But basically, it's kids dancing or lip syncing to music.
Oh, that's it. So it's not...
It's a video service.
Okay, I see. All right. And Snapchat, what's that? Similar to that? I don't know.
Snapchat's not for you.
I think... Sorry?
You're not a Snapchatter.
No,
PinPoint Health is not a Snapchat.
Put some dog face on you, or
that's what's... Okay.
It goes away after 15 seconds.
I'm just...
people into.
Someone would listen to this show and think I'm, 85 years old.
No,
34.
You're busy. You have a life.
I'm 34 and I don't know any of this stuff.
It's good. You're okay. You're fine. You're going down the right river, my friend.
Yeah, that's good.
Yeah,
okay, thank you. Well, I guess we can end it here then.
Yeah, good.
What else are we talking about? So, the big things, as always, is I'm always a fan and I think a proponent of getting your injuries and pain dealt with in the early stages, acute phases. Really, really important for so many different reasons in terms of prognosis, likelihood to not to get better and to not become chronic. We've talked ad nauseum in terms of the chronic state of things, how that creates a neuropathic component where you now have also neuropathic, meaning it's sort of wired in your neurology now. Like whether there's a problem there or not, you have neurology sending signals. And the best example of that is the phantom limb pain, which we've talked about before as well. And where it essentially shows us that you can have a problem without the physical without the physical thing even being there.
Learned.
Yeah, so that tells us that there's these things called brain maps, that these areas of your body exist in your brain, and it's not just about there being a problem at the location. It's not just about if it's your left hand and it's chronic, that it's only a problem in your left hand. There's also probably an area of your brain, according to these brain maps, that will have a problem. And so even if we can treat the physical aspect of it and get that better, we don't necessarily completely get rid of the pain signal. Now, there's some new stuff that they're working on. They've been working on it for a number of years now, on ways to sort of get at this type of brain map and how we can maybe target it to treat these things. But the point that I'm trying to make is the complexity of it, right? And so if you let something become chronic, now you're also dealing with that aspect of it, whereas that doesn't exist in the acute phase.
Right.
And, so the question becomes, at what point, if you do something today, how soon should you see somebody? Should that be within an hour? Should it be within 6 hours, 12, 24 hours? I think it depends on how bad the pain is. Obviously, if this is like the worst pain you've ever felt, or there's trauma involved, then, you don't fall off a ladder. I think we had a call a few weeks ago that someone brought up where the person had called, fallen off a ladder, had a massive bump on their knee, and it wasn't getting any better. And they were just sort of like, well, I've been massaging it, and it's not getting any better. It's like, well, there was trauma there.
Right.
That is usually something that you should get dealt with. I'd say if there's trauma, a fall of some sort, anything like that, as soon as possible. Like that, those
Especially
are the instances.
The head, your noggin.
Oh, geez. If you've got trauma to the head and you've got any type of symptom that doesn't seem normal, like that's immediate. Waiting an hour could potentially kill you if it's the wrong thing. So it's crazy. Well, let's go through that. I think we have to take a break, but when we come back, we'll talk about the things that the hot ticket items that
hierarchy
you need.
of necessities when it comes to your health care. 416-870-6400 star 640 on cell. Pinpoint Health Show continues. Global News Radio. It is 11:23. Final show of the decade, end of the year for the Pinpoint Health Show. Pinpointhealth.ca. info@pinpointhealth.ca to reach out through email and on social as well. Pinpoint Health or Dr. Lou. And for the remainder of this hour, you got questions, bring them on. 416-870-6400 star 640 on cell, either for yourself or calling in for a friend or family member anonymously. Doesn't matter. Bring it on. Love to get the conversation
for the last
started.
show of the decade.
Yeah.
Sounds sort of morbid. Like, I guess, well, I don't know. Maybe that's all context, right? Depending on your mindset. Like, to me, when I hear that, that's like, end of a decade. That's, I don't know.
Way back in the 2020s. In the 2010s.
It's crazy. I always tell this story. When I started, I guess when I first started getting my G1 driving, it would have been 2002-ish, around that time, something like that. And I remember the big thing was everybody, like my age group and the guys that I hung out with, we all wanted Honda Civics. Like that was the thing. Like back in the day, that's where you could soup them up a little and do those things. And I remember, like, one of my friends got a 1999 Honda Civic SI or whatever, and I remember thinking, like, wow, like that is brand new. And even to this day, when I hear, like, a 1999 Civic, in my head, I still have that initial reaction where I'm like, oh, my God, that's brand new. And then you stop and you think, you're like, no, that is old.
That's an ancient car. The fact that you just said G1, Jody and I are going, G1? It just used to be a 365 and you got your license?
Yeah, it's still a G1.
I did G1, G2.
Yeah,
you did not.
I did so.
Easy there. Nobody is as old as you, buddy.
Lie.
I'm not lying.
Learner's book. Lessons, license.
After the 360, so it was a 360, and then
you got your learners, your permit. They call it 365 because once you did your written test, you had a year to go out and get your road test, so it was called 365.
Oh, okay.
And then within that year, you just practiced, went to driving school, got the old man to take.
This is even
whatever.
before
go
roads,
the next day
before
if you want.
roads were paved. Like
yes, that's it. That's right. You had a feed bag in the front of you. Oh, my God. Yeah.
So anyway, before we went to break, we were sort of talking about the hierarchy of, like, when do you do certain things? Right. And then we sort of were talking about, like, with head trauma, right? Yeah, you should intervene right away. Now the question becomes, well, what's this head trauma, right? Like, how bad is it? Is it, an apple fell off of a tree and hit you in the head? Should you be going to an emergency room? I think it really is consistent with symptoms as well. So it's not just about what the trauma is, but what happens following the trauma. So let's say you're walking, you slip on ice, and you fall and you hit your head, and you've lost consciousness. Okay, so all of a sudden you come to and you're like, oh, I think I lost consciousness.
Where the hell am I?
Yes, exactly. Like you got to get somewhere ASAP. If you start to have what would be described as the worst headache of your life, you got to get immediate medical attention. That could be something like a stroke, okay? So if you ever hear anybody say, this is the worst headache of my life, and I mean, people might say that in passing, like all of a sudden they get a headache and like, oh, this is the worst ever. No, but is it genuinely the worst headache you've ever felt in your life? Is the pain that excruciating? Then yes. If there's any weird symptoms, like all of a sudden you've got weird numbness and tingling in an arm or a foot, or all of a sudden you can't move your arm, or your speech is slurred, or
face drops or something.
Yeah, any of those things, that is immediate attention. That's immediate. Like, we're not talking about immediate because you just need to get dealt with. It might be save your life when there's head trauma. Now, if you fell and, landed really hard on your butt and there was severe pain and swelling, and even if there was a fracture in there, I mean, if you didn't go to the hospital within the next 10 minutes, that may not necessarily be the difference between life or death. But if you fractured your pelvis, you should be getting to the hospital within the next 6 hours for sure. So I think when it comes to trauma, because the average person isn't going to understand the intrinsics of this, if there's trauma, go get yourself analyzed. It doesn't necessarily mean that it has to be an emergency room. It might also be an urgent care center or a walk-in clinic, and they can triage it. And if they think it's more serious and you need to be going to an emergency room, then you go to the emergency room. The other thing is when things happen insidiously. So that meaning there's no point of origin that you can think of. The example being, I woke up, I went to go brush my teeth, and all of a sudden my neck started to hurt, right? Is that something you need to rush to an emergency room? Probably not. Now, if there's red flags that go along with that, and again, the red flags with neck pain are similar to the stuff with headache. If you've got weird numbness, tingling anywhere, loss of strength anywhere, you have a headache with this neck pain, you have slurred speech, any of these weird symptoms, that is a medical emergency, because sometimes neck pain can also be related to stroke type of things. Now, it sort of depends on a lot of things, and we're simplifying a lot of things here. And when I think about this stuff, I mean, the picture is so much greater. But so I guess the point being, with things that happen and there's no specific onset, if there's weird symptoms or things that seem out of the ordinary, that needs to get looked at immediately. It's no different than if you had, so let's take low back pain, for example. Low back pain with leg pain, is that a medical emergency? Probably not. Low back pain with leg pain, there's also paresthesia in the genitalia. You're having problems going to the washroom.
Or lack of control.
That is a medical emergency. That is right away, you got to get to a hospital, because that might be something like a cauda syndrome. So the point that I guess I'm trying to make here is the average person, and I mean the average person, the average listener, isn't going to know all this stuff. So get it checked out. That's why I'm talking. That's why I'm saying in the acute phase, you got to get these things looked at, because how can you possibly know all of these things? And if you don't know all of these things, you're potentially risking your eventual well-being on not knowing. Is that a risk you're willing to take with these things? Probably not. I mean, if you sprain your ankle playing basketball, that's probably not a medical emergency, like
get some ice on it quick.
You can get some ice on it, manage it, see what's going on. You hurt your knee during a run. Yeah, same thing. There's no big trauma. It's just low-level pain. I think most people will inherently understand that pain, the intensity of pain should be telling you how likely of an emergency this is too, right? And so listen to your body with those things. It's very, very important.
Yeah. 416-870-6400 star 640 on cell. You still got some time here. Bring it on. You have questions about this stuff or your hierarchy. We'd love to talk about it and talk to Dr. Payne as well. You can do so. 416-870-6400 star 640 on cell. PinPoint Health, Global News Radio. It is 11:31. Yeah, free ride to answers to your health care. You still got some time. 416-870-6400 star 640 on cell. You know what? And sometimes I know we do talk off air that. Okay. You understand a lot about healthcare. That's your job, that's your bailiwick, that's your expertise. But sometimes, and I've asked you stupid questions as well, uninformed questions, and it's just, we've often said we'd love to do an after dark show.
Oh, jeez.
My God.
No,
you idiot, you don't go to the hospital for that. Why are you calling me?
Yeah.
And you can't blame people because they don't know.
It would be more about the comedy behind
100%.
it. And I think that type of dark humor, it actually is a way for some people to learn, right? Like some people learn better with that type of darkness. I remember I had a high school teacher. It's really funny, actually. You can never do this stuff nowadays. But in order to get a point across, he'd always swear with it. Yeah. And the reason wasn't because he was swearing, but he knew with swearing, it would bring our attention to it. And we would exactly. And so I think like an after hours, uncut version of the Dr. Payne show or something like that, where I could just let loose.
Be a podcast.
Oh my God, it would be crazy. But I do think it would provide an added advantage. I'll never do it so long as I have a license, because I'll lose my license in doing it. But if the day ever comes, which hopefully it doesn't, then maybe. But we were talking about last week at the beginning of the show, Greg stayed back a little bit and was asking some stuff about a rib problem that he had been having. Mm-hmm. And I was saying to you that I got an email from somebody. Essentially, it wasn't very nice, and the nice version of it is just don't have that guy on your show.
See, we love that.
Yeah, it was not clearly as nice as that, and it was just sort of like I got that email and I was like, really, like, is that what people have time to do? And I guess, and you and I now and Jody were talking off air, like, are there people that actually genuinely, like, I guess clearly there's a person, because he sent me that email, that doesn't like Greg and said don't put that guy on your show. But I wonder, do some people hate me, which is totally fine. And I guess the reason why I bring it up is because if you do sort of hate me and you're listening, or you disagree or whatever, I'd love to actually speak to you to sort of understand like what it is. Because I think that's interesting. Like, it's not so much that I'm ready to have this argument on the radio or anything like that, but I sort of want to understand what is it that you did. Like, is it a disagreement? And maybe there's something. I mean, I think one of the most important things about being a human being is our ability to change, right? We're very, very good at that in adapting. And I think of myself as someone that if I'm ever presented with something that is more than I knew, some information that I knew is new or I didn't know, I'm willing to change my mindset for sure. And all the things that I say on the show now are as a result of the mindset that I have because of the research that I've done, the education that I have, et cetera, the experience and all those things. There might be something that I'm not aware of, but I think if presented with the right information and with the right scientific evidence, I'd be willing to change for sure. I just wonder if other people would be willing to do that. Like if you're willing to call me and tell me, and I'd love to have that call and that conversation. But I would also hope that whoever that person is willing to change as well, because that's the most annoying part about dealing with people is when you're speaking with somebody and you're providing with them good quality information that's backed up by science, and they don't want to accept it. They're just like, no, this doesn't matter. Like, and I guess the easiest example of that is the anti-vaccination sort of debate. And I mean, my stance on it is clear, and I've spoken about this before. I believe we should be vaccinating. In my opinion, there is no, and not just my opinion. Again, when I say my opinion is based on the scientific literature. Right. That's how I make my, and also look in understanding history, how vaccinations have essentially, saved millions.
Yeah, I don't want polio tomorrow.
Yeah. And so there's no good research. There's no good argument that I've heard where I can sit here and accept and say, yeah, we probably shouldn't be vaccinating ourselves, our kids, and all those things. I've not seen that evidence. There's no good argument for it for me. So my stance is, yes, we should be vaccinating because there's a clear advantage. Does that mean we need to be vaccinating for every single thing? Maybe that I think I can. There's more leeway in my opinion there, but I think for the classic things, the MMR, the polio, those types of things, like, come on, like, it's also sort of a slap in the face to all the people who died from that, that essentially gave us that knowledge to create the vaccine, right? Because it takes someone going through something in order for us to know what's wrong with them, to intervene, and so it's sort of like we've come so far to the point of eradication of a lot of these things. And then we're going to sit here and say, well, now that we've eradicated it, I don't think
let's just take seatbelts out of cars.
Yeah, exactly.
Not necessary.
Yeah, exactly. Yeah, you're just going backwards, and it's crazy for me. It's a very, very hard thing for me to accept. I think a lot of it, the problem with a lot of people is I think people accept dogma. Right? So if you hear something and it resonates with you and it sounds like it makes sense, I don't think a lot of people actually go through the exercise of saying, okay, trying to be impartial, saying, okay, so you hear someone talk about the anti-vaccination thing and you hear it and it sounds like, okay, this person really sounds like they know what they're talking about. So let me go and see for myself. I think a lot of people just hear things and they accept it and then they just regurgitate. Yeah. They're just regurgitating whatever they heard or whatever they read. And I've had this, you meet people that say, yeah, but I read this book, and there's still an inherent bias to a book. Yeah. That's why there's such thing as peer-reviewed scientific evidence, right? Because that's how you can actually, of course, if someone is writing a book, they have an objective. They want to get across a message to sell the most copies of that book to make money. Doesn't matter what anybody says. That is their objective. So I don't think that necessarily means that they're lying about their beliefs or things like that. But I do think that you need to look at those types of biases and consider them when you're trying to make these decisions for your life. So it's pretty crazy. But going back to that person that had the negative comment about Greg, at the end of the day, I can really have anybody I want on my show, right? I think it's my show, so I'm allowed to do that. And I completely disagree with the comments about Greg. I think he's a great person. We get along very, very well. And he had a legitimate question about his health. And I'm happy to answer those questions. No different than if I had a legitimate question about my car, he's willing to take that. So I think that's the thing. And I think if people can't accept that, and if you're willing to go out of your way to send an email, I don't know.
One's not bad, pal. I got 19 years next door on Q107. Why are you playing that Bob Seger song? You suck. Okay, perfect. I didn't schedule it, but that's fine. You can blame me for the entire Seger catalog.
Humanity.
416-870-6400, star 640 on cell. Bring it on. PinPoint Health continues till 12 o'clock. Global News Radio. 1142, PinPoint Health. Info at PinPoint Health. You want to reach out when we're not on the air, anytime for that matter, through email and PinPoint Health or Dr. Lou on social like Instagram and Facebook. There is plenty of content to absorb and learn from on there.
And you can message us through those channels as well, right? If you add us to Instagram and things like that, send us a message. If there's anything, for anybody that's following us on any of the social media platforms, if there's a video you'd love to see about something or you'd want to hear me talk about something, I'm happy to have that. Even with the radio, if you're looking for a specific topic, let us know, and we'll do our very best to get the experts in those fields. If it's not something that I feel confident enough to comment on or within my scope, right? Because we've had people call me about everything, and I'm not an expert in everything. Mm-hmm. And I think that's, I guess, one of my strengths is realizing that I'm not an expert in everything, and my team is full of a bunch of different experts for that very reason, so that at the very least, we can say that PinPoint Health is an expert in pain and injury management when you consider the totality of the team.
Again, 416-870-6400, star 640 on cell for the remainder of the hour. If you have questions, it's a quiet day. It's
a quiet day.
Doing stuff. Yeah. What do you think? What do you think is coming up next year in 2020? What do you see? Is there any big health? I want to say fads because it's not really a fad, but any things you should be concerned of for next year you see coming up?
Concerned of? No. There's always, I think the next wave of medicine or of healthcare in general is going to be like functional medicine. So functional medicine being where you're understanding all. So once upon a time, it was very much, and this change has been happening. So it's not like, 2020 all of a sudden. It's sort of been happening anyways. Before it was very much localized, right? Like if you had an elbow problem, it was an elbow problem.
Treat the elbow.
Right? Yeah. And if it was a shoulder, it was a shoulder. And we now have become more functional and to say, well, it's a shoulder, but it's related to your neck, it's also maybe related to your diet, et cetera, et cetera. So there's a lot of things. So taking the totality of that person into consideration. I think we're also going to move towards more genetic-based healthcare where understanding your genetics can help you treat those things. I think the big thing that's starting to come out is a lot of the more natural procedures. So, we do PRP for the knee, but they're doing PRP for all kinds of stuff now.
I've heard it for lower back. I've heard
lower
it for
back. They even do it for hair loss.
I'm in.
So I think that, and again, there's this big push around like the natural, so stem cells, which are not massive yet here in Canada, but definitely in the US, there's a lot of stuff coming out with stem cells. There's even injections that they now do with stem cells and PRP together for tissue regeneration. So I think that's the next wave of like the next 20 years will be more about regenerating things. So instead of, oh, okay, you've got a knee that we need to replace, let's try to regenerate it. The problem with it right now is number one, we don't know for sure that it works. That's a big thing. Number two is it takes a very, very long time in the instances where there is some research to show like, okay, well, this knee cartilage was worn out and all of a sudden we've injected it with stem cells and now it's better. It takes a very, very long process to achieve that. So it's incremental over long periods of time. And because of all of the first two things, it means it's very expensive. Right, so that's all stuff, but no different than flat screen TVs. Once upon a time, were $10,000, $15,000 to get one. Right, when you plasma TVs and things like that, and now they're everywhere. So maybe in the next 20 or 30 years, there'll be a faster way. It'll be cheaper and all of those things. But it always, I guess, starts to some extent in that way. But I think that is sort of the future of medicine and healthcare. I also think people. One big shift that I think has happened over the last decade is people are starting to realize it's more about prevention than it is treatment.
Just about to ask you
right?
that. Yeah.
And I think most people realize that like there's a bigger push towards an active, healthy lifestyle and eating better. And I think we're at a point where most people I shouldn't say most people, but I guess most people that I interact with, there's healthier choices that are being made, right? And we're starting to, and I think that's a big deal. Once upon a time, it was always this thing about a cure. Like, where's the pill for solving cancer?
It's all the end game, right?
Yeah, it's all the end game. Like, where's the final treatment? I think now we're starting to understand, well, that's actually quite hard, and we'll keep trying to figure something out. But in the meantime, let's worry about prevention and early detection, right? And a lot of the things where we've made hallmark milestone types of achievements have also been around that early detection, right? So mandate, like, making sure that people start getting colonoscopies at a certain age, breast exams, prostate exams. These are the things that we were able to identify, and we're not necessarily preventing them. We're more than anything identifying them early, right? Heart disease and stroke and all these things, trying to give the public the knowledge like we just talked about. And we've seen those commercials about stroke, right, where all of a sudden someone has slurred speech and they're not lifting their arm. Call 911 right away. So I think prevention and early detection is a big thing, and I think the cure aspect of it all is becoming harder to see that is actually a possibility for everything. It may be a possibility for certain things, and I think finally when we get to it, we're going to realize that it's really about the genetics. Like, I don't think if we do ever come to, like, let's say a cure for something, I don't think the cure will be here's a pill and you do this, or if it is, it has an effect on genetics somehow, where we can look at a certain component of your genetics and say, right there's the problem, take it out, put the right thing in, or how, I don't know. That's not me. Yeah, I'm not a geneticist, so that one's tough, and I don't know the intrinsics of it, but I believe that's sort of where we're moving towards.
416-870-6400, star 640 on cell. Your calls, there's a couple coming in now. You still got some time. Give us a call. PinPoint Health Show, Global News Radio. And getting right back to it here, we get to our calls right away. Randy, thanks for calling in. Good morning.
Good morning.
What's up, pal?
I'm 70 years old, and I've developed arthritis in my hands.
Okay.
And I was wondering if these advertised copper compression tension gloves work.
So I'm not familiar with the copper aspect of it. Compression gloves, I am familiar with that. Sorry?
I believe the commercials that I've seen on TV is by a manufacturer called CopperFit.
Okay, yeah, I don't know specifically about that. What I can comment on is the compression aspect. So anytime arthritis will tend to cause swelling, and that swelling will tend to pool in those areas, so whether it's in the hands or the feet. So the compression aspect is just really designed to help get blood back out of that area, get the inflammation out of it, which should try to help a little bit in terms of the pain and maybe the mobility and all those things. Is it going to cure the arthritis? No. So I mean, it might be an option. I'm always like, you should always be worried about like infomercials on TV selling a specific thing, because I think the primary objective there is making money, right? These things have been happening for the last 50 years, and which one of them have become mainstream where it's like, yeah, no, now that's everywhere. It started on the shopping channel, and now they use it in hospitals. Like, that stuff just doesn't really happen. There is a benefit to compression when you have swelling due to arthritis, for sure. I don't know enough about the copper aspect of it or this specific brand, but again, compression can be helpful in terms of controlling some of the symptoms, but it's not a cure, right? So, but there is really no cure for arthritis in your hand. So all of it is really management. So that compression may play a role in the management aspect of it. Now, it also depends on if there's actually swelling happening, and all those things. So yeah, that's sort of my short answer to it.
Gotcha.
Okay.
Okay, thank you.
No problem.
Thanks, Randy. Enjoy the rest of your weekend. Nancy, thank you for holding on. Good morning.
Good morning.
What's your concern?
I'm going to read to you a finding from a CAT scan. I'm talking about the medial tibia plateau.
Yep.
And it says it's highly suggestive of insufficiency fracture
Right.
of the medial tibia plateau.
Yep.
Without any collapse of the articular surface. My symptoms are swelling below the tibia, or at the tibia and then below. Not excessive, but certainly noticeable. And then, of course, it's painful to walk on it.
Right.
Do you know of anything that you can do to either stop the progression or even maybe heal over or repair the fracturing?
So I feel like have you called with this same question before?
I talked to you before and said I was going to pursue it further.
Okay.
So I thought I would tell you what I have found from the CAT scan.
Yeah.
And I have seen an orthopedic surgeon who he's probably 40 years into the business, and he hasn't seen this.
An insufficiency fracture? Well, I doubt that he hasn't seen that. But so what did he or she say about the treatment aspect of it?
No treatment, which is why I'm calling at this point. Again, just observing.
Yeah, so he probably meant no surgical treatment, right? There's always some treatment that could be done. Again, I think the important thing here is that findings on imaging are just findings. It may not necessarily be the source of the problem. And that doesn't just go for knees. That's pretty consistent across the body, that these findings that happen on imaging may not necessarily, they could just be what we call incidental. The only reason why we know it's there is because we decided to take some type of an image due to some other symptoms. So it might be correlated, it might not be. The only way for me to know is to actually assess your knee. So if you're interested in that, I'm happy to see you assess your knee and then take into consideration what the findings on the CT scan are. But it's not a diagnosis, right? That insufficiency fracture is a finding on imaging. It's not necessarily the diagnosis of your problem. And the only way for me to make the diagnosis is to correlate a physical exam with that image.
Okay.
Okay.
The interesting thing is that it's also on my other knee, not to quite the same extent.
Do you have problems on the other knee?
Yeah.
Okay.
It started with the right knee, and now it's with the left knee as well.
Right. Yeah. Again, it might very well be something. I need to look at it, is the point. I need to assess it, because I can't just go based on a finding on an image. That's and if you've heard me on the show before, I always talk about that they're just findings. They're not, that's why they're called findings. You said it yourself. You said, let me read you a finding. It's not a diagnosis. And even at the bottom where it says impression, an impression is a radiologist impression of what that finding may mean, but it is intended for correlation of a diagnosis by the treating clinician.
Yeah. Okay.
Okay.
Thanks, Nancy. Appreciate you. Want to reach out to 1-855-55 Lou, DRLOU, or info@pinpointhealth.ca. It's interesting. People sometimes read everything. Oh, I got this. I got subluxation. I got facet joint problems. I'm wheelchair bound. No, that's just what's going on back there. That might not be the problem.
Findings are a dangerous thing because I think we were speaking about, well, we've talked about this a lot, but I think last week as well. None of them sound good. Right. There's no sound, there is nothing that you can read in anatomy that ever sounds good. I can make something that is totally benign. I could talk in medical terms right now about something that is totally, absolutely benign, and it's going to sound scary. Yeah. Right? And it's going to sound, and then even more so, this isn't necessarily benign, that finding, but it's a finding. Insufficiency, fracture, right? That's all of a sudden is ugh. Now, it may be significant. I don't want to say that it doesn't matter. The point that I'm trying to make is that we cannot rely just on imaging for a diagnosis. A diagnosis is a clinical opinion by the treating clinician. And that treating clinician has to take everything into consideration, including the physical exam and the imaging and whatever other testing is done. So that's the advantage of seeing somebody. That's what I'm here to do, is to correlate those things for you.
We're done. That's it for this show, this year, this decade. We'll catch you next Saturday back with more of the Pinpoint Health Show. You'll want to reach out in the meantime. Again, info@pinpointhealth.ca. Pinpoint Health on social as far as Instagram and Facebook are concerned. And there you go, 1-855-55-Dr. Lou, DRLOU. We'll catch you next week right here, Global News Radio.